Speaker recognizes Representative Morse.
Thank you, Madam Speaker. I rise today in support of House Bill 4310, the 2024 budget for the Department of Health and Human Services. This budget is critical to improving health outcomes statewide, ensuring we are protecting our most vulnerable people, especially children in the child welfare and juvenile justice system, and expanding access to our behavioral health system. In the course of working through this budget, we have heard from many organizations and individuals across the state. We've engaged with our colleagues on the committee, heard requests from other members and the public at large in 2 days of public comment. We've worked many hours with House Fiscal and House Policy to craft a budget that invests in the areas that are most needed in a sustainable way. We hope everyone can understand that we made careful consideration with every request. To those ends, this budget invests in every part of our state, from a critical access hospital in the Upper Peninsula, to a substance use disorder clinic in Berrien County, to obstetric services in the Thumb, to health disparity reduction community health clinics in Detroit, to behavioral health crisis access beds in Owasso. The budget acknowledges that every community has unique needs that this budget works to address. This budget values our direct care workers, the need for behavioral health providers, and the work our counties do in public health and child welfare. This budget reflects that we value the health of mothers. We acknowledge that health inequities lead to poor maternal health outcomes, and we are working to improve the system to ensure our mothers live to raise their babies. This budget fulfills basic needs: food, health care, safe homes, and clean water. One of the largest investments is an increased direct care worker pay by $2.50. While this is an extremely expensive investment, it is a step toward reducing the worker shortage by paying a living wage. Of particular note is that while this budget's bottom line is $2.5 billion more than last year's, $2.2 billion of that total is federal dollars. We are leveraging our state dollars in an incredibly effective way, bringing our tax dollars back to our state for the provision of health care and social services. Additional highlights include, in behavioral health, recruitment and retention of behavioral health providers, and an accelerated degree scholarship and retention program for social workers, because we have heard from many that work in that area that it is not beds we are lacking so much as people, the workers. We have invested in expanding the CCBHC system, mental health care for first responders, and a variety of investments in substance use disorder prevention and treatment. In the area of mother and infant health, we have investments in the Perinatal Quality Collaborative, the Michigan Breastfeeding Network, centering pregnancy and hospital maternal health incentives, as well as eliminating the 5-year Medicaid waiting period for pregnant people. In the child welfare system, we are increasing the Child Care Fund to 75% reimbursement for counties. That's work to provide wraparound services for children in our juvenile justice and foster care systems. We are increasing financial support for foster families, investing in foster care respite services, and supporting our Michigan court-appointed special advocates who do the really difficult volunteer work to advocate for our children during their judicial procedures. Finally, in public health, we are providing our counties with 50% reimbursement for public health services, providing a sustainable source of funding for victims of crimes, investing in food support such as the Michigan Agriculture Surplus System and resources for food deserts. And we will have grant funding available for home improvements to ensure safe and healthy homes. And finally, funding available for clean water. Madam Speaker, this budget is one that addresses so many critical needs across the state, yet leaves many needs on the table as our resources are never enough. We've taken great care to consider the greatest needs and address them in a sustainable way. I urge this body to vote yes in support.